Hello, and welcome to Prep Alberta, an introduction to prep access within the Alberta context. My name is Brooke Biggin, founder of EMHC, and I'd like to thank you for joining us today. I know that an online module isn't everybody's cup of tea. Our initial plan was to come and see you all across the province in person, but of course, COVID threw a wrench in those plans as it has much else in our lives. But we do thank you for joining us today, whether prep is something that's new to you or it's something that you're quite familiar with. We do feel and hope that this presentation will better equip you to support people in your communities who might benefit from PrEP. So just a quick note on sources. A couple years ago when EMHC developed PrEP Alberta, there were no provincial guidelines. And so really we were, with every single statement we were making, going back and citing, some of the initial studies. Fortunately, now there are provincial PrEP guidelines. They are quite comprehensive. They are up to date. And so we really use that as our primary source. And so essentially everything in this presentation and the rest of PrEP Alberta's resources are based on the information in those guidelines. In cases where the information is different from what's in the guidelines, we do cite those sources. However, if you do find anything is inaccurate, out of date, or isn't presented in an accessible way, please don't hesitate to contact us. You can reach us at connect@ourhealthyag.ca. And lastly, this presentation is only intended for educational purposes. If you are considering PrEP, we do think that this will be a useful presentation for you. However, any medical decisions should be made in consultation with a healthcare provider. So just a brief overview of today's presentation. Really, our objective is to increase your knowledge about PrEP and how to access it in Alberta. Of course, with the intent that as you go back into your community and your organizations, that you feel better equipped to support people who might benefit from PrEP so that they can better navigate the PrEP access pathway. The intended audience is really anyone who supports people who might benefit from PrEP. So that's service providers, maybe you work at a community-based organization, maybe you work in an Indigenous community, maybe you're a healthcare provider. If you are a potential prescriber, so a physician or nurse practitioner, AHS has a special online module on their AHS PrEP page. If you complete that module along with an application, you can become a designated PrEP prescriber. And we'll speak a little bit about what that means a little later in the presentation. But for now, we welcome you to continue to stay with us. In terms of what's included in this session, we do cover just briefly some HIV background in case you're coming to this presentation and are less familiar with HIV. We spend the bulk of our time on the PrEP access overview. So talking about what PrEP is, how to access it, what somebody's experience might be while on PrEP, and then talking about some of the consultation data we receive from communities across the province about some of the challenges and opportunities they face when trying to access PrEP. And then finally, we'll just discuss ways that you can engage with PrEP Alberta, even outside of this presentation, because there are lots of ways that we hope this resource can be useful for you in your local context. Now, if you don't have the next 50 minutes to sit here through this presentation, that's okay. All of this information is available at prepalberta.ca. We also have some shareables on the site to make understanding PrEP and PrEP access easier for you and the communities that you serve. We'll start by talking a little bit about HIV background. We'll cover HIV and its health impact, transmission, prevention, and then what the HIV context looks like here in Alberta. Of course, if you're not familiar with HIV, this won't be comprehensive. We definitely do recommend that you consider accessing a training from a community-based organization. There are lots in Alberta who offer introduction to HIV presentations. Definitely reach out to one of them, or you can go to Katie at katie.ca, and they have lots of resources around HIV there. If you are quite familiar with HIV, please feel free to skip forward to the PrEP access overview section of this presentation. In terms of HIV and its health impact, HIV is a communicable disease. It does impact somebody's immune system. So, if left untreated, somebody with HIV, their immune system would become less effective at fighting infections, especially compared to somebody who doesn't have HIV. Over time, if left untreated, HIV can progress to AIDS and eventually lead to death. Fortunately, over the past a couple of decades, there have been a number of really important advances in HIV treatment. And now people living with HIV who are diagnosed, linked to treatment, take their treatment as prescribed, they can lead long, healthy lives. A secondary benefit to HIV treatment is that when people living with HIV take their treatment as prescribed, they typically achieve what's called an undetectable viral load. And when somebody has an undetectable viral load, generally it's accepted that they can't transmit HIV sexually to their partners. In other words, undetectable equals to untransmittable, or U equals U. This U equals U campaign, or even better, a movement, has really been led by and for people living with HIV. And they've had a huge impact at the community and at the structural level. If you want to learn more about this, you can from the Prevention Access Campaign, your local community based organization, or at kd.ca. Now let's take a moment to look at HIV transmission. If you're on the front lines, chances are that somebody at some point has come to you and said, "Hey, I just did this thing. Do I have HIV?" And there are a number of factors that can impact the likelihood of HIV occurring in any given situation. But I really find that this HIV transmission equation breaks it down in a way that's more accessible. So you need three things for a possible HIV infection to occur. The first thing is a source of infection, so a bodily fluid containing HIV. That would be blood, semen, vaginal fluids, rectal fluids, breast or chest milk. Of course, you'll notice that saliva is not included there, which means you can't get HIV through kissing. Now, even if you did have a source of infection, however, say somebody's blood got on your arm, but your arm was on broken skin, there were no cuts, no scrapes, no way for that fluid to access your bloodstream. Well, in that case, there's no source of entry, which is really the second thing that you need. Really, when we talk about sources of entry, we're talking about broken skin, the opening of the penis or the wet linings of the body, like the vagina or front hole, the rectum, or the foreskin. Those are examples of sources of entry. And so you would really need a bodily fluid that contains HIV, a source of infection, to come into contact with a source of entry. Now, of course, typically a bodily fluid containing HIV and a potential source of entry don't just randomly come into contact with one another, right? There typically would need to be some kind of activity with a possibility of HIV transmission. And that's really the third thing you need for a possible HIV infection. And so, possible activities that carry a possibility of transmission include sex, particularly anal or vaginal or frontal sex. It can also be through the sharing of drug use equipment, especially as it concerns injection drug use. There are other ways that HIV can be transmitted as well, like to a fetus or baby during pregnancy, birth, or chest feeding, sharing needles or ink to get a tattoo. But really, the most common mechanisms for transmission in the Alberta context are through anal and vaginal sex or through the sharing of drug use equipment. And so, if you have all three of these things, a source of infection, source of entry, and an activity with a possibility of transmission, you have a possible HIV infection. And so, somebody in that case, if all three of those things were present, they would want to, speak with a healthcare provider and ensure that they get tested. Now, we do have a number of HIV prevention options that can interrupt that transmission equation. And so some of those include barrier methods, so condoms, which are really effective at preventing HIV and other STIs. There are different ways that HIV treatment can be used to prevent HIV infection. And so we discussed U equals U. We're going to talk about PrEP more. There's also PEP, which is post-exposure prophylaxis, which is the use of HIV medication after potential exposure to HIV to prevent infection. There's also not sharing drug equipment, particularly for people who participate in injection drug use. There's also choosing sexual activity with a reduced chance of HIV transmission. So, oral sex carries, in most cases, essentially a negligible risk of HIV transmission occurring. That would be considered much lower risk than penetrative vaginal or frontal or anal sex, especially without the use of a condom or other HIV prevention options. And then finally, there's regular HIV testing because we do know that when people are diagnosed and linked to treatment, and take it as prescribed that they can become undetectable. However, they'll never know and never have the chance to become undetectable unless they're diagnosed. And so, regular HIV testing, I think, is a really important aspect of prevention. Now, to conclude our HIV background section, just a brief discussion about HIV in Alberta. And so, HIV rates in Alberta have remained relatively consistent over the past decade and typically are somewhere close to the national rate. However, HIV does not impact everyone in Alberta the same. And so, as you can see, there are a number of populations who are overrepresented in Alberta's HIV data. Those include gay, bi, and other men who have sex with men, Indigenous people, people who belong to African, Caribbean, and Black communities, people who use drugs, and trans and non binary people. Now, you'll see an asterisk next to trans and non binary people. We have that there because there's not a lot of data in Alberta that speaks to the HIV experiences of trans and non binary people. However, where that data does exist, we do know that at least some trans and non binary communities are disproportionately impacted by HIV, which is why we've included them here. Now, you might look at this group of populations and ask, what do they all have in common? They look pretty diverse. Well, really, each of these groups experience different forms of stigma, discrimination, marginalization, and it's well demonstrated the role that stigma plays in determining an individual or a community's vulnerability to HIV. And so it shouldn't really be surprising that these groups would be overrepresented in Alberta's HIV data. And not only are these groups more vulnerable to HIV infection, but they also experience different barriers and challenges to accessing health education, interventions, and services, which is really all the more reason why it's important that the people that they rely on for support are equipped to help them navigate the PrEP access pathway so that they can access this important HIV prevention option if it's something that would benefit them. Now, before we leave this slide, if you are interested in more Alberta HIV data, you can go to Alberta Health's interactive health data application. You can review HIV data by year, by gender, by population. And so, if you're interested in learning more about HIV data for the communities that you serve, that might be a good tool for you. Now, diving into the Alberta PrEP Access overview, the main event. So, first, we'll talk about what PrEP is, how it works, and who might benefit from it. So, PrEP is the use of HIV medication by someone who's HIV negative in advance of a possible exposure to HIV with the intent to prevent HIV infection. PrEP usually comes in the form of one pill, which includes two types of HIV medication. While Health Canada didn't approve these medications for use as PrEP, so for preventative means, until 2016, these medications have been used in HIV treatment for some time. And so we do know that they are safe and generally well tolerated. Most often, PrEP is prescribed to be taken daily. In some cases, it may be prescribed to be taken intermittently or on demand. And we'll discuss the differences between those two regimens in just a bit. Now, how does PrEP work? We won't get deep into the science here, but essentially, when PrEP reaches sufficient concentration in a person's body, it acts like a chemical shield, which prevents HIV from making more copies of itself, ultimately stopping somebody from becoming HIV positive. The CDC says that when taken at least 4 times per week, that PrEP is 99% effective at preventing HIV infection. Now, that doesn't mean that people should only take it 4 times a week. If it's prescribed daily, people should take it daily, 7 times a week. But if somebody misses 1 or 2 doses, even, the PrEP should still be effective. However, it is important to say that, if PrEP is not taken as prescribed, people are missing multiple doses, especially taking it less than 4 times per week. PrEP's effectiveness can definitely decrease, and that can increase the likelihood of HIV infection. So it's very important that people take PrEP as prescribed, and we'll talk about why that's so important in just a bit. One last note on this slide: while PrEP is very effective at preventing HIV, it does not prevent any other STIs, so things like syphilis, for example. And right now, at the time of this recording, and it feels like, for years now, we've been in the midst of a syphilis outbreak here in Alberta. And of course, getting people on PrEP won't necessarily prevent syphilis transmission. And so it's important to have a discussion with people who are seeking PrEP or on PrEP about ways that they can utilize other potential STI prevention options as well. Now, who might take PrEP? The truth is, a lot of different people. The main thing is that somebody would be at an elevated risk of HIV infection, and PrEP could help to mitigate that risk. Now, of course, people might explain their motivations differently, even if they do fall in those circumstances. So they might explain it as taking charge of their own sexual health or reducing anxiety in regards to sex. And really, it's important that as service providers and healthcare providers, that we can have those discussions. We can help people interpret some of those motivations and help them determine whether or not PrEP is a good option for them. If you are looking for clearer criteria, the provincial PrEP guidelines do establish eligibility criteria to help determine if someone is a good candidate for PrEP. Somebody must meet these criteria if they are trying to access publicly funded PrEP through the provincial PrEP program. If people are accessing PrEP through other means, they don't necessarily have to meet these specific criteria, though they are a good guide in helping determine who might be a good candidate for PrEP. And we'll talk a little bit more about the different coverage pathways shortly. Now, we've included some of the eligibility criteria from the provincial PrEP guidelines. We won't go through these in detail. If you do want to take a longer look at them, feel free to pause your screen, or you can review all of this information in the provincial PrEP guidelines. We do link to them through the prepalberta.ca website in numerous places. You can also access them on AHS's PrEP page. So here you see the eligibility criteria for men who have sex with men, both cis and trans women, and gender diverse people. Here you see the criteria for heterosexual people. And then finally, for people who inject drugs. Now, you will notice that the criteria are different for each population. However, at the core is an assessment of whether or not somebody's at an elevated likelihood of HIV infection and whether or not PrEP would help to mitigate that. Now, of course, if somebody that you're supporting doesn't meet these criteria, if it's determined that PrEP is not a great option for them, the road doesn't end there. There are lots of HIV prevention options available to people. We discussed some of those earlier in the presentation. So we encourage you to have that discussion with the people that you're supporting to help them find an HIV prevention option that's good for them, even if it's not PrEP. Now let's talk about accessing PrEP. So, once somebody has determined that PrEP is an HIV prevention option that they're interested in, there are a number of steps that they will need to follow in order to access it. And so, in this section, we'll discuss accessing PrEP coverage, baseline screening, and picking up medication. Historically, the high cost of PrEP was a significant barrier for many. However, with the emergence of public funding options and lower cost generics, many people are able to access PrEP for free or at a significantly lower cost. Now, determining the coverage option is really important as it can impact the PrEP access process itself. And so we'll review some of the most common coverage options below and discuss how they're different and how they might impact the PrEP access process for someone. We'll start with the provincial program. So essentially, anyone who has an Alberta healthcare card who meets the PrEP eligibility criteria in the provincial guidelines can access PrEP at no cost through Alberta Health's publicly funded PrEP program, which is administered by Alberta Blue Cross. However, what's unique about accessing PrEP this way is the fact that in order for prescription to be eligible, it must be received from a designated PrEP prescriber. So if somebody goes to a pharmacy with a prescription that has not been received from a designated PrEP prescriber and they're seeking coverage through the provincial program, they will be denied. So this point is very important. So what is a designated PrEP prescriber, you ask? So AHS has an online module and an application form on their PrEP page. We do link there from prepalberta.ca as well. And any physician or nurse practitioner that wants to be recognized as a designated PrEP prescriber must complete that process. Once they've completed that process, they will be added to a list of designated PrEP prescribers. That list includes prescribers from across the province, organizing them by zone. It includes location, contact information, and now even if they're taking patients or not. One of the challenges with the list, however, is that there aren't as many PrEP prescribers outside of the Edmonton and Calgary zones. So if you have somebody seeking PrEP in a rural community in northern Alberta, there's a chance that, they may not have a PrEP prescriber near them. And so that's where a service provider can come in, working with their family physician to ensure that they complete the requirements to be added to the designated prescriber list, reaching out to provider networks to get more family physicians and nurse practitioners in your area to become designated PrEP prescribers so that there's just more support available for people in your community who might benefit from taking PrEP. Now let's discuss non-insured health benefits, or NIHB. So eligible First Nations and Inuit individuals who receive health benefits through NIHB can access PrEP at no cost. People accessing PrEP through NIHB aren't required to access a designated PrEP prescriber. So that's one key distinction between the provincial program and NIHB. And so in some cases, this might actually be an easier route for people who are eligible, who might live, say, in a rural area where there's a lack of designated prescribers. Of course, people who are eligible for PrEP coverage through NIHB, they may also choose to access coverage through the provincial program if they do have an Alberta healthcare card. However, if they do choose to go that route, they would need to follow the requirements of the provincial program, which includes accessing a prescription from a designated PrEP prescriber. An important note about NIHB is that people could have been accessing coverage for PrEP through this program for several years now, definitely before the provincial program was announced. Unfortunately, it wasn't something that a lot of people were aware of, and a lot of groups who were pushing for PrEP access at the time didn't really do good enough of a job of ensuring that this information reached the communities who could benefit from it. And so I think we all bear some responsibility for that. Definitely, with PrEP Alberta at EMHC, we could have done a better job earlier on of making sure that people were aware of this. So it is really important that now that people who could benefit from this information have it. Now, if someone is not eligible for coverage through either of the public options, they may wish to check with their private or group benefits provider to see if there's coverage for PrEP under their plan, and if so, what process they would have to go through to access coverage. If someone has a 10 to 20% copay for prescriptions on their plan, that means they pay about $25 to $50 for a 30-day supply of PrEP. Definitely better than paying for the entire amount out of pocket. However, still out of reach for some communities most disproportionately impacted by HIV. The other thing to note is that there's no guarantee that a private or group benefits provider is going to cover PrEP. However, it may be worth trying if somebody's not eligible for either of the public options. If somebody can't access PrEP through either of the public options or through their private or group benefits provider, they may choose to pay for PrEP fully out of pocket. If somebody chooses to pay for PrEP fully out of pocket, it could cost them approximately $250 for a 30 pill supply, and that's for generic PrEP. So, still quite expensive, definitely out of reach for most people who would benefit from PrEP, but is an option for those who are able to do so. One last note before we leave this coverage slide is that it's important for people to know that the Federal Interim Health Program, which provides temporary limited health coverage for certain protected groups, including some resettled refugees and refugee claimants, does not provide coverage for PrEP. I know that some initial PrEP messaging around coverage failed to address whether or not people who access benefits through that program could access PrEP coverage, and so we wanted to make sure that it was included in this session. Once somebody determines which coverage option works for them and therefore which prescriber they might need to see, they should meet with the prescriber to discuss getting a PrEP prescription. Before they receive a prescription, they will need to undergo some baseline screening requirements, and that would often include a discussion with a healthcare provider, blood work, urine collection, and possibly swabs. The purpose of these is to test for HIV status, other STIs, and to assess baseline bodily function. If someone tests HIV positive through this process, they would not be given PrEP but would instead be referred for HIV treatment. If someone tests HIV negative, but there are some concerns, say that they had an exposure to HIV that may not yet show up in the testing, PrEP prescribing may be delayed at that point. However, if somebody does test HIV negative and there are no other concerns, they should receive a PrEP prescription. PrEP prescriptions can be filled at any pharmacy in Alberta. However, not all pharmacies keep PrEP in stock, so that means they may need to order it in. So it's a good idea for somebody to call ahead to a pharmacy to see if they have it in stock, especially if they have to travel some distance. You'd hate for somebody to have to travel to a pharmacy expecting to get a PrEP prescription only to be turned away. One last note about this is that in order for people to get a prescription for a refill for PrEP, they will need to meet some monitoring and follow up requirements first to receive that refill from their prescriber. And we'll talk about that in just a bit. Now we'll discuss what somebody's experience might look like while on PrEP. And so that includes, PrEP regimens and adherence, monitoring and follow up, possible side effects and PrEP interactions, and what they should do if they decide to stop taking PrEP. In terms of PrEP regimens, most often PrEP is prescribed as a pill to be taken daily, once per day, 7 times a week. So the vast majority of people who are on PrEP in this province will be prescribed daily PrEP. There is another less common PrEP regimen, which is on demand PrEP. With on demand PrEP, somebody takes 2 pills 2 to 24 hours before sex, and then 1 pill daily until 48 hours after their last sexual encounter. On demand PrEP was studied amongst men who have sex with men, and it did reduce HIV infection risk by 86%. One thing to note, however, is that on demand PrEP has not been proven effective for other populations and is not recommended for cisgender women, trans men, or anyone having receptive vaginal or frontal sex due to the longer period required to achieve protective vaginal drug levels. So, really, on demand PrEP would only be used in certain circumstances with specific populations. But ultimately, the decision around somebody's PrEP regimen should be made through a discussion between the patient and the provider. Now, regardless of which PrEP regimen somebody's on, it's very important that they take PrEP as prescribed. The CDC says that when taken at least 4 times per week, PrEP is 99% effective. However, if somebody misses multiple doses per week, perhaps is only taking PrEP 2 to 3 times per week, that could significantly reduce PrEP's effectiveness, which can increase the chance of HIV infection occurring. The reason why this is so concerning is that if somebody becomes HIV positive while taking PrEP, it can result in HIV resistance to the medications that are used in PrEP. And given that these medications are also used for HIV treatment, this could end up closing off some treatment options for that person. So it is very important that people take PrEP as prescribed. Now, sometimes that's easier said than done. There are a number of challenges that some people face in taking PrEP as prescribed, and they may require additional support or strategies that they can implement to improve their adherence. And that's where service providers can come in. If you're supporting somebody who's taking PrEP and they're having challenges with adherence, you might want to consider sharing some of the following tips: taking medication at the same time every day, setting a phone reminder, storing the medication somewhere visible. If someone's using recreational drugs, making a plan as to when and how they will take their medication. And then finally, if somebody doesn't have stable housing or they experience other factors which make medication storage more challenging, they should speak with a community based organization or their pharmacy about possible medication storage options. Not every adherence tip or strategy is going to work for everyone, and so service providers can play a really important role in helping people navigate adherence challenges and finding adherence strategies that work best for them. Now, as mentioned earlier, there are some monitoring and follow up requirements for people who are accessing PrEP. Typically, these are required before somebody receives a refill for their prescription. Follow-up assessments include blood tests, urine collection, possibly swabs to check for HIV, STIs, and possible side effects due to taking the medication. These follow-up assessments typically occur 1 month after beginning PrEP and then every 3 months afterward. Now, some people might find it challenging to fulfill all of these follow up requirements and could really use support from a service provider, whether that's reminding them of appointments, helping them access appointments at different times, taking advantage of times when somebody has shown up for healthcare services to see if those requirements can be fulfilled at that time while the patient is there. A number of ways that service providers can try to work with healthcare providers to make this easier for people, particularly people who face multiple barriers to accessing care. One last point that I do want to make around monitoring and follow up is that you now have a group of people who may be at a higher risk in some cases of STI infections. So, for things like syphilis, who are now getting tested every 3 months, which is probably more frequently than many of them were getting tested before. So, if an STI infection does occur, people are getting tested more regularly so that they can be diagnosed and treated and are less likely to pass it on to other people in the community. So I do see the monitoring and follow-up requirements for people taking PrEP as also performing an STI prevention function potentially. In terms of drug interactions, there are really many with PrEP. So there are no known interactions between PrEP and recreational drugs, though of course use of alcohol or recreational drugs might impact adherence. For prescription drugs, there are a few cases of dangerous interactions between PrEP and other medications. There are some exceptions, which include some HIV and hepatitis C medications. For over-the-counter medication, people using PrEP should use caution when taking NSAIDs due to possible kidney injury. And finally, a couple points worth making. PrEP is safe to take during hormone therapy, and PrEP is safe to take with contraceptives and during pregnancy. Of course, people should always have a conversation with their prescriber and or their pharmacist when taking a new medication to see how it might interact with other drugs that they're on. In terms of side effects, most people don't experience any serious or long term side effects. The most common but still rare side effects include common things like diarrhea, nausea, dizziness, headache. These are generally short lived and pass within a few weeks of starting PrEP. Some less common but more serious side effects of PrEP can include problems with the kidney or the liver. That's one of the reasons why it's important that people complete follow up requirements at every 3 months to measure any potential impacts that medication might be having on some of these bodily functions. As a last note, some people with hepatitis B can also experience flare ups of the disease while taking PrEP, and so it's important that that's monitored by a healthcare provider. Now let's take a look at what happens when somebody decides to stop taking PrEP. Of course, just because somebody might be at an elevated risk of HIV infection now, and therefore PrEP might be of benefit to them, doesn't mean they're going to be at an elevated risk of HIV infection, say 1 or 2 years from now. They may get into a monogamous relationship with someone where there's no risk of HIV transmission really occurring, and at that point, PrEP may no longer be a great HIV prevention option for them. So, what do you do when somebody considers stopping taking PrEP? Well, first of all, the decision should always be made in consultation with a healthcare provider. There are important reasons for that. If somebody does decide to stop taking PrEP and there is still some likelihood of HIV infection occurring, even if the risk is lower than before, a discussion should be had with the individual about other HIV prevention options that they might want to consider. In addition to this, and you can see this in the provincial PrEP guidelines, it's recommended that people continue to take PrEP for up to 28 days after their last potential exposure to HIV, and that they undergo follow up HIV testing up to 8 weeks after they've stopped taking PrEP. Now, before we conclude today's session, we should take a quick peek at some of what we heard around PrEP access challenges and opportunities for different populations here in Alberta. As a part of Prep Alberta's work, we had a number of conversations with community members and stakeholders from a number of populations that are overrepresented in Alberta's HIV data. We've included a list of some of the different consultation groups we did with different populations right here. And at the end of each of those consultations, we took the notes and we analyzed them for common themes to try to tell us a little bit more about each of those populations' experience with PrEP, particularly as it relates to any access barriers or opportunities that they might experience. The full results of these consultations can be found at prepalberta.ca. I definitely encourage you to go look at it. You can look at the results from all of the populations, or you can look at the section that's relevant to the populations that you serve. There's just some really practical information there that you and your organization can use to optimize your supports and services so that people seeking PrEP from the communities you serve are better supported through their PrEP journeys. But for those who are interested, we're going to take a sneak peek at some of the results that we found. So first, let's take a sneak peek at cross-population barriers. So these are barriers that would have emerged out of multiple consultations with different populations. We won't go into each in a great amount of detail here. Of course, you can go to prepalberta.ca to see that. But just as a quick glance, you see disconnected systems is one theme that emerged from across a variety of consultations. Of course, some people who are disproportionately impacted by HIV face challenges that most people don't. And to overcome some of those challenges, they might need different supports in their lives, different parts of the system to engage with one another, to help facilitate access, to help facilitate better health outcomes. Of course, that's not always how our systems are set up. So, say that somebody doesn't have stable housing and there are concerns around medication storage, that person might need their pharmacy, their PrEP prescriber, their community support worker to all engage with one another to ensure that that person is able to store their PrEP safely and then access it when they need it. Another common barrier that emerged from multiple consultations was provider knowledge and availability. So, a lot of healthcare providers in this province still don't know what PrEP is. And so, a lot of people found it challenging to find providers, particularly potential prescribers, who knew what PrEP was. The other side of that coin is around availability. So, if you recall, when we spoke earlier about the designated prescriber program here in Alberta that people need to access in order to get a prescription that is eligible for coverage under the provincial program, well, there is a list of designated PrEP prescribers, and it has them organized by zone, for example. People in Edmonton and Calgary, if they go and look at that list to try to find a designated prescriber, who's obviously somebody who understands PrEP because they would have completed the designated prescriber module and demonstrated some interest in PrEP because they would have applied to be on the list. Well, people in Edmonton and Calgary, they can find those people. There are a large number of prescribers in the Edmonton and Calgary zones, many of whom are taking patients. However, when you start to go outside of those zones, particularly in the south, central, and north zone, and the more rural areas within those zones, you start to find that there are far less designated prescribers in those areas, which makes it hard for people to be able to find knowledgeable prescribers who are recognized as designated prescribers in their area. And then lastly, limited PrEP education and access also emerged as a common barrier faced by a number of the populations we consulted with. Of course, there are some populations who do know a lot about PrEP. So, gay, bisexual, and other men who have sex with men, you'll often find a high level of knowledge within those communities. That's because there's been a lot of sharing of knowledge about PrEP within those communities by organizations who serve that population. However, when you start to look at other populations that are disproportionately impacted by HIV, so for example, people from African, Caribbean, and Black communities, people who are Indigenous, you'll find that there's not necessarily as much knowledge amongst those communities or the people who provide services to them. And so that's often a barrier to PrEP access because if somebody doesn't even know what PrEP access is, or the people they rely on for supports and services don't know what PrEP is, well, then they're definitely not going to be able to access it. Of course, there's information about those common barriers and some of the others we didn't touch on prepalberta.ca. Taking a quick peek at some cross-population opportunities to make PrEP access easier. These would be opportunities that emerge from across a number of consultations with a number of populations here in Alberta. So some opportunities to enhance PrEP access. So one common theme that emerged was enhancing knowledge. So ensuring that people at the community level who might benefit from PrEP are aware of it and that they understand the PrEP access pathway that's applicable to them, to ensure that healthcare providers and service providers are aware of PrEP to support facilitating access for people who would benefit from it. So, whatever we can do to enhance knowledge amongst different pockets of the community and the sector who don't know about PrEP, that would definitely help enhance access. Another common theme that emerged throughout the consultations was expanding representation. And so, as discussed, a lot of knowledge about PrEP, a lot of resources that promoted knowledge of PrEP were by and for gay, bi, and other men who have sex with men. And so, if you look at a lot of those resources, you're going to see often a lot of white cisgender gay men, and that doesn't reflect many of the communities that are disproportionately impacted by HIV in this province. And so it's important for people to see themselves in PrEP resources so that they can understand that this is something that might be for them. And that's something we've really tried to do with PrEP Alberta, with some of the resources that you can access within your organization. All of our posters, postcards, wallet-sized cards, our online materials, our website, all of those represent a wide variety of individuals, more reflective of the communities that are disproportionately impacted by HIV in this province. And we definitely invite you to access those. Taking a quick look at some of the unique barriers. So, of course, there were some barriers to PrEP access that applied to numerous populations, but there were some that were unique to specific populations. So, just taking a couple, so trans invisibility in data, right? So, often data isn't collected on trans and non binary populations as it relates to HIV and other STIs. And so it can be challenging for community members and the people that serve them to understand whether or not trans and non binary people might be at an elevated likelihood of HIV infection and might benefit from PrEP. So that's definitely one barrier that some trans and non-binary people might have to accessing PrEP if it's something that might benefit them. For newcomers, language barriers was a unique barrier to that population. Many people who come to Canada, they might come from somewhere, of course, where English is not their first language, and therefore engaging with resources or other forms of knowledge sharing that are in the English language, they may not be able to fully comprehend them at this point. And that might inhibit them from gaining important knowledge they need to know whether or not PrEP is a good option for them and how to access it. We'll move on now, but of course, you can access more information about each of these at prepalberta.ca. Now let's take a quick peek at some of the opportunities to enhance PrEP access that were unique for different populations. So you can look at Indigenous populations. So one opportunity to enhance PrEP knowledge and access is the use of Indigenous knowledge pathways. For African, Caribbean, and Black communities, one theme that emerged from that consultation was the importance of storytelling for some folks within that population, and the fact that in-person knowledge sharing could be a more effective way of sharing knowledge about PrEP than physical materials, for example. For gay, bi, and other men who have sex with men, enhancing practical access knowledge. So this is a population with a lot of knowledge about PrEP, but of course, not everybody understands how to navigate the access pathway. So for example, do some people within that population who might identify as First Nations understand that they can possibly access PrEP through NIHB? Right? So ensuring that that population has access to some of the more practical elements of the PrEP access pathway. And that's it for our sneak peek. Like I said, I definitely invite you to go to prepalberta.ca to read the report in full, or at least the sections relevant to the populations that you work with. Now, to end the presentation, we'll talk a little bit about how you can engage with PrEP Alberta. As we've discussed throughout this presentation, most people in Alberta who would benefit from PrEP access can access it at no or low cost. However, there are lots of folks that don't know this yet. Back in 2018, when PrEP Alberta first launched, the provincial program hadn't started yet, and knowledge about PrEP was still pretty niche. And so initially, PrEP Alberta really just focused on gay, bi, and other men who have sex with men, given that that was the population that EMHC focused on at the time. However, now, as we've discussed throughout this presentation, most people who would benefit from PrEP in Alberta can access it at no cost. And so it's really important that people are aware of that. And so with some support from Alberta Health, we've really worked with a number of community members and stakeholders from across the province to update and expand this resource so that PrEP Alberta is useful for a number of populations who are impacted by HIV in Alberta. In terms of some of the work we've done a range of consultations, as we discussed earlier. We've updated, expanded, and relaunched prepalberta.ca. We've developed a number of promotional resources for PrEP and PrEP Alberta, which you can request at your agency. We'll talk a little bit more about that in just a moment. We've developed online resources for sharing information about PrEP on social media. And of course, we've developed this presentation for healthcare and service providers. In terms of how you can engage with PrEP Alberta, there are a number of ways. So first of all, you can engage with the website. Go to prepalberta.ca, explore it. There are sections that are quite accessible for community members to learn more about PrEP and how to access it. There's a section for healthcare and service providers where you can access different resources. Please explore it, share it with colleagues, share it with community members over social media. We think it's a really great comprehensive resource for anybody who wants to learn more about PrEP and PrEP access in Alberta. You can request PrEP Alberta promotional resources that you can share with your networks, with your communities. We used a diverse range of models here in Alberta that really reflect the different communities that are disproportionately impacted by HIV in this province. We have Black models, we have Indigenous models, trans and non-binary models, a range of people so that the resources you share with your community will reflect that community. You can request those resources by going to prepalberta.ca to the resource section, or you can reach out to us by email at connect@ourhealthyg.ca. We will produce and mail those to you at no cost. We can also share some social media shareables with you. These can easily be shared over, say, Facebook or other social media platforms. And they're just more digestible ways to engage with the most relevant information about PrEP and PrEP access. You can also access those at prepalberta.ca or send us an email and we'll send those to you. In some cases, we're also happy to adapt resources for your organization or community if your community needs to hear about PrEP and how to access it, but that message would be most effective coming from you. Then we're happy to discuss adapting some of our existing resources to feature your organization or better reflect your community. And so you can just email us and we're more than happy to have that discussion with you. PrEP Alberta has really been a collaborative effort. We really want to make sure that all organizations with an interest in PrEP, all communities who would benefit from PrEP are able to engage with these resources. So please don't hesitate to get in touch if there's any way that we can better support you as you better support people who would benefit from PrEP in your community. Just to close, we do want to share some acknowledgements. We've worked with a wide range of partners throughout this project. We really want to thank people for taking the time to engage with this important work. Of course, we may not have included everyone. I'm sorry if anybody's been missed. Let us know, and we're more than happy to edit this slide. And of course, we do want to thank Alberta Health for funding this important work. And that's it. Thank you for taking the time to be with us today. We hope this was a valuable use of your time and that you feel better equipped to support people in accessing PrEP in Alberta. If you have any questions, comments, concerns, don't hesitate to reach out at connect@ourhealthyg.ca, and we'd be more than happy to help you. Thank you very much and have a great day.